Hello and welcome. Today we're diving into a condition affecting the urinary system, bladder leukoplakia. We'll explore its causes, symptoms, diagnosis, and management, providing you with a comprehensive understanding of this often misunderstood condition. The exact cause of bladder leukoplakia remains unclear, but chronic irritation and inflammation of the bladder lining are strongly implicated. Long-term catheter use, recurrent urinary tract infections, especially those caused by specific bacteria, and bladder stones are all considered potential contributing factors. In some cases, chemical irritants or even certain medications may play a role in triggering this condition. Essentially, anything that persistently inflames the bladder mucosa can potentially lead to leukoplakia. Leukoplakia at its core is a metaplastic process. It represents a change in the type of cells lining the bladder. Normally, the bladder is lined by transitional epithelium, a specialized tissue designed to stretch and contract with bladder filling and emptying. In bladder leukoplakia, these transitional cells are replaced by squamous epithelium, a flatter, tougher type of cell, similar to the cells found in the skin. This change is a response to chronic irritation. This squamous metaplasia can then lead to the formation of thickened, white plaques, the characteristic leukoplakia we observe. These plaques can contribute to inflammation and discomfort, potentially affecting the bladder's ability to function properly. Bladder leukoplakia is relatively rare, and its precise prevalence is difficult to determine. It's more commonly observed in individuals with a history of chronic urinary tract infections, prolonged catheter use, or bladder stones. It affects both men and women, although some studies suggest a slightly higher incidence in women. The exact demographic distribution is not well defined due to the rarity of the condition and potential for misdiagnosis or underreporting. The symptoms of bladder leukoplakia can vary significantly from person to person. Some individuals may experience no noticeable symptoms at all, particularly in the early stages. However, as the condition progresses, common symptoms include frequent urination, a persistent urge to urinate even when the bladder is not full urgency, pain or burning during urination, a dysuria and blood in the urina hematuria. In some cases, pelvic pain or discomfort may also be present. It's important to note that these symptoms can also be indicative of other urinary tract conditions, making accurate diagnosis crucial. Diagnosing bladder leukoplakia typically involves a combination of methods. A thorough medical history and physical examination are essential. Urinalysis is performed to check for infection or blood in the urine. Cystoscopy, a procedure where a thin, flexible tube with a camera is inserted into the bladder, allows direct visualization of the bladder lining and is the gold standard for diagnosis. During cystoscopy, biopsies can be taken from any suspicious areas, such as the white plaques, and sent to a pathologist for microscopic examination. The pathologist will confirm the presence of squamous metaplasia, solidifying the diagnosis of bladder leukoplakia. While there aren't strict classifications or types of bladder leukoplakia as such, it's important to consider the extent and severity of the condition. Some cases may involve small, localized areas of leukoplakia, while others may be more widespread, affecting a larger portion of the bladder lining. The presence of associated inflammation or infection is also a key factor in determining the appropriate treatment approach. The treatment and management of bladder leukoplakia are primarily focused on addressing the underlying cause and relieving symptoms. If a urinary tract infection is present, antibiotics will be prescribed. If bladder stones are contributing to the irritation, they may need to be removed surgically or through other means. For symptomatic relief, medications such as analgesics and anticholinergics may be used to manage pain and urinary urgency. In some cases, particularly when leukoplakia is extensive or symptomatic despite conservative measures, surgical interventions such as transurethral resection of the bladder lesion, TURBT, or fulguration burning may be considered. Regular follow-up with cystoscopy is crucial to monitor for recurrence or progression. Unfortunately, there's no guaranteed way to prevent bladder leukoplakia entirely, given that the exact cause is often unknown. However, minimizing risk factors is key. This includes practicing good hygiene to prevent urinary tract infections, promptly treating any infections that do occur, avoiding prolonged catheter use whenever possible, and maintaining adequate hydration. If you have a history of bladder stones or other bladder problems, working closely with your healthcare provider to manage these conditions is essential. The prognosis for bladder leukoplakia is generally good, especially when the condition is diagnosed and treated early. In many cases, addressing the underlying cause and managing symptoms can lead to significant improvement. However, it's important to be aware that leukoplakia can sometimes recur, and there's a small but documented risk of malignant transformation to squamous cell carcinoma of the bladder, a type of cancer. Therefore, regular follow-up with your urologist is crucial for ongoing monitoring and early detection of any potential complications. Research into the molecular mechanisms underlying bladder leukoplakia and potential therapeutic targets is ongoing, aiming to improve treatment strategies and outcomes in the future.